Support provided by Walters, Papillon, Thomas Cullens, LLC, specializing in business litigation and personal injury cases for over 40 years.
I serve as the president and CEO of Franciscan Missionaries of Our Lady Health System. So you have to ask the question, what is Franciscan Missionaries of Our Lady Health System? Well, we are a ministry of the Franciscan Missionaries of Our Lady. And the Franciscan Missionaries of Our Lady, or the FMOLs, are the sisters that sponsor our organization. And in the not-for-profit Catholic world, sponsor means own, or you can think about it in that kind of term. There are 14 sisters that remain here in Louisiana, serving the entire state of Louisiana. They are part of a larger congregation that is based in Paris, France, and includes about 500 sisters worldwide. They were inspired and continue to be inspired by the works of St. Francis and have an absolute total commitment to Catholic health care. They came to the state of Louisiana more than 100 years ago, originally establishing a hospital in Monroe, Louisiana, and then moving to Baton Rouge sometime later. So our organization, the ministry, again, formed by the sisters, guided by some core values. And those core values are important to us. It is how we act, it's how we judge our behaviors, it's the standards we attempt to live up to. The first among those is service, and that is the privilege of reaching out to meet the needs of others. The second is reverence and love for all of life, acknowledging that all of life is a gift from God. Joyfulness of spirit is our third core value, and awareness of being blessed by God in all things. Humility, being authentic and serving as an instrument of God, as Francis was humble. And justice, striving for equity and fairness in all relationships, with special concern for those most vulnerable. So those guide us, and I have for you just a quick story. I'm privileged that good stories bubble up to me, and I, in email, get stories from throughout our organization. And this one I actually received this Sunday from an event last Wednesday, so it was a week ago today, September 5th. And it is just an example of our mission alive. And this comes from our hospital in Lafayette, Our Lady of Lourdes. So I'll read it verbatim the way it was presented to me. So last Wednesday, despite a very busy day in our emergency room with very high acuity patients, 2 of our nurses took time out of their busy day to shower a gentleman who had not bathed since February. He was brought in by Acadian Ambulance Company and was described by the paramedic as having the worst smell he's ever endured in his life. While bathing the gentleman, both of the nurses were soaking wet and were using at least 20 different towels to remove feces, stained urine, etc. from the gentleman. One of the nurses stated when she was shaving his face, he started to cry. No doubt God had sent him to us for a reason. She touched him and said, God sent you here. It is now our job to take care of you. When the nurses were recognized for their humble service, their response was simply, we're just living the mission. And ultimately, I think that's what our health system is about, exemplified in the work of those couple of nurses. Now, you may know us more as a network or a system of healthcare services, and we are that. And most specifically, people know us for our hospitals, although as I'll explain, we're a lot more than just hospitals. But we do have 5 primary hospitals. You're familiar with Our Lady of the Lake here in Baton Rouge. We also have St. Elizabeth and Gonzales. Up in the northeast part of the state, we have St. Francis in Monroe. We have Our Lady of Lourdes in Lafayette, and we have Our Lady of Angels in Bogalusa. But again, we have so much more than just hospitals. We have senior housing, we have assisted living, we have ambulatory clinics, we have surgical hospitals, we have outpatient rehab, we have urgent care, we have imaging, and many of these things we do in partnership with others in our community. We also are dedicated to the education of the future healthcare workforce through our activities at Franciscan Missionaries of Our Lady University and through our graduate medical education program at Our Lady of the Lake primarily. So this just gives you a sense of kind of that continuum of care is what we call it, where we take care of you in the home, in outpatient setting, and in the hospital throughout the community. It might surprise you to learn that more than 70% of our revenues as an organization come from sources other than traditional inpatient care. So 70% come from other than inpatient traditional care. So we are a lot more than just acute care hospital. Our work currently and for the future is largely about how do we coordinate care across all these various points of service. Some of you are numbers people. Some of you have familiarity with FMOLHS. I had a little bit of familiarity before I was introduced to this role, but what I did know is the hospitals that make us up. Our Lady of the Lake has a national reputation, a very positive national reputation, and that is a big part of what attracted me here. St. Francis has a good reputation in its community. We're very proud of all our hospitals and the way they serve our community. My introduction today is really to tell you about how all that fits together. So these are the combined numbers for the organization. I'll call your attention to just a couple of them in particular. The number of emergency room visits is a big number by any standard, about 330,000 annual ER visits. By the end of the year, we will acquire Women's and Children's Hospital in Lafayette. That will add about another 30,000 ER visits, which will bring us over 360,000. Just in the Baton Rouge area, under the management of Our Lady of the Lake, when you talk about what we have going on at Our Lady of the Lake between the pediatric ER, the psychiatric ER, the adult ER, what goes on the North Baton Rouge ER, the ER in Gonzales and the ER in Livingston, you combine that all under one management team, and that's one of the top 5 or 10 busiest collections of ERs in the country. So that gives you just a little perspective. So you can go to any of the big cities and they don't match what we have in terms of ER services here. For those of you that are business people, we have 14,000 total employees, about 10,800 full-time equivalents. Our total salaries, wages, and benefits across the state of Louisiana is about $958 million a year, so approaching $1 billion of salaries and benefits, and relatively good-paying jobs. And this last year, from the balance sheet, our total assets for the first time exceeded $3 billion. Did I get that right, Bob? Got it, okay. So big numbers, and I'll talk about some more in a minute or two. Some of the things you may not know about our health system here in our own community here in Baton Rouge. A very large teaching presence. You see the number 944, that's inclusive of all the various students that are rotating through and our residents and fellows. Over 150 medical residents and fellows at Our Lady of the Lake. I had the opportunity early in my orientation to actually spend a day rounding with medical residents, medical fellows on both the pediatric and the adult side. And it was fascinating to see that education happening and at a very fine level. You'll notice here magnet designation. That's a designation that is important in hospitals. It's designated by the American Nursing Association as a hospital that nurses have good experiences working at. All the structure is in place to provide an excellent place to work for nurses, and that's something we're proud of and we use as a recruiting tool and will continue to value in the time ahead. And then I'll talk more in a minute about our pediatric focus, of which I'm sure you have some familiarity. In terms of clinical innovation, ACGME, that's the American College of Graduate Medical Education. I mentioned that Scott Wester is in Chicago representing us at an ACGME conference today because we are one of the pathway innovators in pursuing excellence in clinical learning environments. The ACGME went across the country and they chose 8 hospitals in the country who participate in graduate education, who are forward-looking, who are visionary, who are working to provide the best possible educational experience. And we are one of those 8. We're 2 years into the 4-year program. Just to give you an idea of some of our company at these meetings, Cleveland Clinic, UC San Francisco, University of Chicago Medical Center. So these are hospitals, academic programs you put up against anyone in the country. Ours is of that same caliber, and I think it's important we recognize that. Quest for Quality just talks about an award we received, one of 3, and it's about promoting more efficient and safer patient care. And that's what we're about. How can we do things more efficiently, safer, higher quality? And then the bottom note there, if you don't recognize all the alphabet soup, MB is Mary Bird Perkins at Our Lady of the Lake. Of course, that's a long-standing partnership there, and I don't know if you have any sense of how fortunate we are to have Mary Bird Perkins here in our community. I came from Houston most recently. MD Anderson was our neighbor. If you have cancer and feel a need to go to MD Anderson, go get a second opinion. I'm sure it will mimic what we find here, and you can get your treatment close to home. It's all available right here, including a gamma ray knife, which is a cutting-edge technology that's only available a few places around the country. I mentioned our focus on the Children's Hospital. Of course, John Paul introduced me. I'm sure he hasn't done his job if you aren't all familiar with our Children's Hospital and the construction that is going on. We are scheduled to open early October, so just a year from now. That's sneaking up on us very, very quickly. We've had nearly $50 million contributed by all of you and your counterparts across the state, so we thank you for that. John Paul would quickly add that we are still accepting donations. That's not a solicitation, is it, Ann? I was told not to solicit today, okay. I recently had an opportunity to tour the children's facilities, and they're going to be second to none. They are coming along very well, ahead of schedule, on budget, which makes me very happy, makes Bob even happier, and the facilities themselves are really going to be outstanding. We've had the services. We've had a children's hospital within Our Lady of the Lake for many years. It's important that you know that. It's not that we're starting a new children's hospital. We're just going to have the physical facilities now that will match the quality of the service that's been provided for the last many years. So all I can say, and I think all you'll say when you see it and get a chance to tour through it over the next year is wow, or yes, it is amazing. Our vision is really to be the children's hospital for state-of-the-art health care for all the kids in Louisiana. We intend to be the children's hospital for the entire state. Matter of fact, we can't support what we're building simply on the kids in Baton Rouge. We have to have a larger base, and we have developed that, and we will continue to develop that over the coming years. A couple of statistics on the Children's Hospital that might be of interest to you. Number of pediatric transports, so that's the number of kids coming into our hospital from outlying areas. That's over the last couple of years. The St. Jude's affiliate, I think we've marketed this pretty effectively, but if you didn't know, there's only 8 St. Jude's affiliates in the country. We are one of those 8. And we have an entire floor in the new building that's dedicated to the St. Jude's and the care of kids with cancer. 25 subspecialties, so there's most everything the child needs is within our network. And with our, I mentioned earlier, we'll be, as part of our growth, we're acquiring Women's and Children's Hospital in Lafayette. They are the third largest provider of pediatric services in the state of Louisiana. We have been the second largest here at Our Lady of the Lake. So when we combine those two, and with our statewide network that's already in place, including services in Monroe and Bogalusa, we'll be the single largest provider of pediatric services in Louisiana. Not that bigger is better, but in this case, it really does help to have that kind of scale to keep the kind of specialists we need to do the good work. And we are really dedicated. If we're going to build a healthier Louisiana, we've got to start with the kids. We can talk a lot about the social determinants of health. We can talk about obesity, mental health, diabetes. If we can help fight these battles successfully early in one's life, then we can help those kids have a long and productive life. And so I think this is something we can certainly all rally around, is promoting children's health and intervening early. So it's certainly my belief that this children's hospital will be a real asset for the entire state. So our vision for the future. We want to provide the greatest value to our communities. And we define value as continuing to provide great quality service that you expect from us, trying to do that at a more affordable price point than what we have historically, and really moving from what we call volume-based healthcare to value-based healthcare. And let me explain just a little bit. Historically, hospitals and physicians have got paid more for the more you do. So you produce more surgeries, you get paid more. You have more admissions to your hospital, you get paid more. And that, as you can imagine, creates somewhat perverse incentives in terms of really trying to create health. So we're trying to shift to what we call pay for value, where the outcomes matter and where we can actually get rewarded as a healthcare system for keeping people out of our hospital, keeping them healthier, intervening earlier, doing early screenings, catching that cancer when it's at an early stage rather than an advanced stage. That's where we see healthcare going. That's where we're going to lead healthcare in Louisiana, because we think it's the right thing to do, and in the end, it's better for our patients, and it's less expensive for our country. Today, healthcare is consuming, depending on which statistic you read, 17-18% of our gross domestic product as a country, and it's trending towards 20%. That's simply unsustainable. That benefits line for you business folks who have people on your payroll, I mean, that keeps growing. It seems like that's the uncontrollable expense. We want to be in a position to help you control that, to keep that at a modest level and keep the growth no greater than the general growth of inflation. Now, how we do that is by trying to provide the right care at the right place at the right time, and that's not always in a hospital. That often means alternatives to hospital care. One of the greatest enablers for us as we try to manage in a value-based environment is an electronic health record that spans the continuum of care that we have. And we have made that investment. It was a large investment. It was several $100 million for us to put a single electronic health record across our enterprise, not just the hospitals, but all our physician offices as well. But we think that will have a payback in how we manage care over time, and we're already beginning to recognize some of that within our organization. You might not realize how advanced Baton Rouge is in already moving along the value continuum, but we're fortunate to have good leadership that conceived of Health Leaders Network a number of years ago. And this is a physician-led organization. The president is Dr. Richard Vath, And he works with the other physicians really on what we call the quadruple aim. And this is a national terminology. Quadruple aim is about 1, improving population health outcomes, improving the patient experience, controlling costs, while 4, providing an excellent work environment for caregivers. And so these physicians rally and say, okay, how can we standardize care in a way that's based on evidence that gets better outcomes? How can we intervene with the proper screenings? How can we manage hypertension or diabetes so as to keep people from being hospitalized? We have about 1,100 physicians active in the Health Leaders Network today. We're covering more than 100,000 lives, primarily in Louisiana, with some in Arkansas and Mississippi, and we see that number growing on a regular basis. And this is us. We're not in the insurance business. It's us working with various insurers in our state to incentivize our physicians differently, to incentivize patients differently, and then get patients involved proactively in their own health care. So as we say here, value, we talk about volume versus value. Ultimately, it's going to be determined by the people that we serve. Now, how we're going to operate in this environment, we're going to live our core values, as you heard about those 2 nurses at Our Lady of Lourdes doing. We're going to see compassion in every one of our interactions, in every one of our relationships. We're going to be a part of the communities that we call home. We're going to make the journey together, and we're going to go where the Lord calls us. So how are we going to promote health, and what can you do to help us promote health? There's some statistics out there. You'll see them presented a little bit differently, but when you divide the pie of the factors influencing health, we've learned that health is influenced about 40%, single largest factor, by socioeconomic factors. Where you live, what your education is, your income, safety. That's 40% of determining what your health is going to be. 10%, this is kind of humbling to a healthcare guy, 10% is actually determined by clinical care. 10%, so a very small piece. 10% by your physical environment, so your built environment. 10% you can blame on mom and dad, your genes and biology. And then the remaining 30% is on our own health behaviors. Do you smoke? Do you exercise regularly? Do you eat semi-healthy? Those are things that are within our control. So we want to work within our communities on those things that we do have control of. And we all can do something to promote our own health and to encourage the health in our family and friends. So I want to take just this second, and you're going to hear us more and more promoting health in our communities and encouraging people to take small steps, both literally and figuratively, to improve one's own health. So I have a short video for you.
We all deserve to live happy, healthy lives. But every day there are factors impacting how we feel about our own ability to be our happiest and healthiest. Similar to our self-esteem, our health-esteem is a reflection of how we feel about our health. Stress at work, trouble sleeping, battling an injury, feeling anxious, losing someone we love. From little setbacks to serious life changes, everything in our lives can affect our overall health. But no matter who you are or what's going on, there's always something we can do about our health esteem. Laughing a little longer, a day out with friends, a quick power nap, or a little physical therapy to heal our bodies and our minds. By doing things that make us feel better or addressing the things that have been weighing on us, we can positively affect our health esteem. And now, there are thousands of medical studies confirming what most of us already suspected. Taking just a few minutes to do the things that make us better, stronger, happier, can calm our nerves, build up our immune system, and change our mindset. So let's get started, because we're in this together, and we'll be there to help you and guide you. so we can all begin improving our bodies, minds, and spirits, and becoming the best versions of ourselves. Together, let's raise our health esteem.
So my challenge to you is, how is your health esteem, and what can you do to make it better? Go to a financial wellness seminar. Go to walk your dog an extra block. Skip dessert tonight. Certainly there's something each of us can do. And share that goal with your friends. So I thank you for your time today, and I think we have maybe just a couple minutes if there are any questions you might have.
Could you describe two of the relationships that you oversee? First of all, with Pennington Biomedical, and then secondly with Blue Cross.
Oh, yes. The question was, explain two of the relationships we have, one with Pennington Biomedical and the other with Blue Cross. And I don't know that I can do that in the remaining time. Certainly with Pennington, we have a very friendly and I think an expanding relationship with them. Especially on the pediatric side, the endocrinology side. As you know, Pennington has a real interest in diabetes and obesity. We have a patient population that has a lot of obesity and diabetes, and so we're going to be doing, already are, and we'll be doing more clinical studies with them. With Blue Cross, we relate with them in a couple of different ways, but largely they're an insurance company. They reimburse us for services. But more and more we're talking to them about how do we change how healthcare is reimbursed. So as I talk about moving from volume to value, Blue Cross has been reasonably cooperative with us and has given us incentives that if we can save money by doing the testing at the right time, intervening earlier, they will share the cost savings with us. And ultimately, of course, we wanted to share it with the employers as well. And so it's that relationship primarily. I know we've been in the headlines in the past with Blue Cross, but overall I would say it's a healthy relationship. Additional questions?
I know there's been a new agreement signed with LSU Health Systems in North Louisiana, and Ochsner is part of it. And how do you function with Monroe and principally the hospital up there? What's that relationship in training physicians?
Yeah, our hospital is St. Francis in Monroe, and as part of this deal, Conway Hospital is the former charity hospital there in Monroe, and we have a friendly relationship there. In terms of training physicians, we don't do a lot of that in Monroe today. However, you might be interested to know that they are starting a new osteopathic medical school in Monroe with about 170 students per year, and we have committed to being active in the preparation of those medical students on a go-forward basis, which we think will be immensely important for expanding primary care and for helping populate the small towns in the north part of Louisiana. Thank you.
Support provided by Walters, Papillon, Thomas Cullens, LLC, specializing in business litigation and personal injury cases for over 40 years.